forming partnerships through training, all through a real-life simulation.
Lung sounds absent on the lower left.
Simulation training for EMS, and it was pediatric trauma.
Madison Valley Medical Center hosted a simulation training this weekend. This comes after voters in the county passed the creation of the Madison and Ruby Valley Ambulance District on the ballot after the May 3rd election.
Bolster not only employees, training, equipment, but to be able to provide a better service for the county.
The training was meant to simulate a 9-year-old getting struck by a truck that sustained head injuries, and they worked together to help the patient as if they were on their way to the hospital.
Pediatric patients are the most uncomfortable. They're the scariest patients that we have, so it's great to be able to practice that in a no consequence environment and be able to learn and have it feel like a real situation.
The need for the new district came about as a growing need was identified for both communities to team up.
To do some joint training and education. I think recruitment and retention of EMTs and paramedics in rural areas is really difficult.
The levy is intended to raise about $465,000 over 4 years to support ambulance services at both Madison and Ruby Valley Medical Centers. Now, in case of an emergency where both teams are needed, they will be able to work together.
They've never worked with each other, so with this type of training, they got to work with each other, not knowing each other.
For Rob, an EMT with Madison Valley Medical Center, says going through the training helped for when a real call comes in.
It felt very real, the level of adrenaline and fear felt like a real call.
He says that being able to expand their network is reassuring.
The people that are around me and know that help is coming, and knowing that they've all done this same training with us is a big deal.
In Ennis, Edgar Cidio, MTN News.